Hello, I'm Sandra Viktorova. Thank you for joining us. Florida becomes the second state in the country to ban local governments from adding fluoride to drinking water. The impact of the new law, which takes effect July 1st, will be significant. 2023 data from the state health department shows that more than 70% of Floridians on community water systems receive fluoridated water. And dentists are warning that the move will hurt children's health. Supporters of the new law say Floridians have been forced to consume fluoride-treated water without understanding how the mineral might affect the human body. Here's Governor Ron DeSantis.
We should all agree that we want people to be able to make informed consent, have informed consent when it comes to these things. Jamming fluoride in the water supply, irrespective of whatever for the teeth, when you can get that other ways, that's impinging on other people's ability, to have access to water in ways that they may not want to be exposed to what is essentially a forced medication.
While the national debate continues to grow, what is clear is that Floridians are getting mixed messages about fluoride's impact on public health.
It's so sad.
There's little quiet time for the primary care team at Healthcare Network in Naples. Busy is typical for Dr. Sal Anzalone, but the pediatrician is preparing to make an unexpected change to his treatment plan for many of his youngest patients.
Most people don't realize that these teeth are susceptible, especially if the baby's breastfeeding or bottle feeding, to decay.
Anzalone says he'll begin prescribing fluoride supplements to children. He's concerned about an impending rise in tooth decay once fluoride is eliminated from Florida's drinking water. Anzalone says he's seen what a lack of fluoridated water can do in rural parts of the country.
I'm very concerned because there's nothing like looking in a child's mouth and seeing black or decay and knowing what that's going to mean for that child, for growth and development. The pain and suffering that occur to children, it's not necessary. Not when we have an answer. We've been very successful, but we're going backwards, I think, instead of forwards.
They can drink away tomorrow's tooth decay.
For decades, science experts have touted drinking water as one of the greatest achievements in public health since the country began fluoridating water in 1945. The Florida Dental Association says water fluoridation reduces dental decay by up to 40%.
It's amazing because it prevents the bacteria from growing. And also, if there is a little bit of decay, it causes remineralization of the tooth that actually brings the tooth back.
But the state surgeon general, Dr. Joseph Ladapo, has recommended against fluoridation of water due to what he calls the neuropsychiatric risk associated with fluoride exposure. U.S. Health Secretary Robert F. Kennedy Jr. said he plans to tell the Centers for Disease Control and Prevention to stop recommending fluoridation nationwide. And the U.S. Environmental Protection Agency, which sets maximum levels of fluoride in water systems, announced it's also reviewing new scientific information on potential health risks of fluoride.
That line is the fluoride line.
The Immokalee Water and Sewer District says it actually turned off the flow of this tank of liquid fluoride in January, based on these state and federal developments. Executive Director Sarah Catala says it's a decision her governing board members studied carefully.
Our board members grew up in Immokalee, so they care about the community and they want to make the best decision for the health of Immokalee. So this wasn't an easy decision because of the fact that there is a lack of dental care here.
Before turning off the fluoride, she says her team kept fluoride levels consistently below recommended guidelines, the equivalent of less than 1 gallon of fluoride per every million gallons of water. The $8,000 savings from removing that mineral this year will now be donated to Anzalone's healthcare network to help provide dental care to kids that need it. Pediatric dentist Dr. Douglas Keck fears low-income children will get left behind.
That's my biggest concern, is that there will be more children in pain. Some of these children who can't afford care in a regular dental office setting will end up in the emergency room. And unfortunately, it will increase the cost of healthcare overall, not just in dentistry.
Thanks for watching. We've got more great content for you, from news to the arts to the environment. So be sure to like and subscribe to WGCU's YouTube channel and follow us on our social media platforms for the stories that matter to you.